We are being joined online by thousands of folks, and so just wanted to give you an update and also to welcome our online folks from over 104 countries. And so welcome to all of them, welcome to all of you, and we're gonna go ahead and get started with the Day 2 Plenary. And just as a reminder, it is Tuesday in case you're jet lagged and lost and all those things. It's Tuesday all day.
Hello everyone, and thank you for being here at the 2025 UNC Water and Health Conference. I'm Matt Damon, co-founder of Water.org, and it's an honor to welcome you to this vital gathering. Today, billions of people live without access to safe water and safely managed sanitation. The lack of safe water and sanitation contributes to millions of lives lost each year, underscoring the urgent need for action. And in our current environment, access to water has never been more essential. Water systems are under increasing strain. More frequent floods and droughts are changing how communities access and use water. Shifting weather patterns make access to safe and reliable water more uncertain and costly. According to UN Water, 3/4 of all recent disasters have been water-related. Traditional approaches aren't enough. We need innovative funding models that attract both public and private investment and that put sustainable solutions in reach for the people who need them most. I want to recognize the importance of young leaders in this movement to solve the global water crisis. Their voices and creativity are essential to shaping ambitious goals and driving collective action. A.Y. Young, a musician and UN leader, is a great example. His Project 17 is harnessing music to rally people around sustainable development goals. That kind of energy inspires all of us to think differently and act boldly. This is exactly what the UNC Water and Health Conference is about. Hosted by the Water Institute and UNC's Department of Environmental Sciences and Engineering, it brings together experts from more than 120 countries to share knowledge, forge partnerships, and accelerate solutions. It's also personal for Water.org. My co-founder Gary White studied here at UNC and is now a globally recognized expert in the water and sanitation sector, at the forefront of developing sustainable, scalable solutions that have empowered millions of people with lasting access to safe water. So, as we begin, let's commit to making these conversations count. Let's lift up the next generation of leaders. Let's push for more innovation in how water solutions are financed and delivered. And let's leave here with renewed determination to create a future where safe water and sanitation are a reality for everyone. Welcome. And let's make this conference transformative.
Thank you, Matt Damon. Those are 4 words I never thought I would say in a row. So thank you, Matt. And now it is my pleasure to introduce to you a UN young leader, A.Y. Young, who's going to come to the stage and share with you what he's been up to for the past few months. Welcome, A.Y.
Thank you. Yo, that was pretty dope, right? I never seen that. I was like, I'm just still like, my heart's like, wow, Matt Damon, he's such a great actor and great person. Oh my gosh. You know, I've been walking like through where the booths are set up, and it's been like really dope, guys, seeing like all the solutions and the solution providers and like and what you guys are doing to bring clean water and sanitation and to achieve Goal 6. And this spirit and energy, like some of you guys, it's like, sometimes I wonder what the why is, like what drives you, because I'm like, I can tell this is not only your life's work, but a passion. So please just like clap for yourself, because it's been incredible to experience. Look, I don't really talk long and I don't really talk much. I'm kind of more of a doer, right? I'm a guy who does like a clean energy concert, and then after the concert, you know, someone gets like food, water, and power somewhere. Like that's what the battery tour is. We do these conferences and these concerts, and we're bringing the world together. And I'm on this like road to 1,000, right? I'm gonna break this Guinness World Record. The first artist in the history of the world, I guess, to do 1,000 concerts with clean energy. What's up? We just did 961, and so, you know, I think what's special, thank you, brother. I think what's special is that we've kind of figured out how to combine like music and sports, which is culture, right? And have impact. So these concerts they're not just clean, we're not just taking over stadiums or arenas or doing these mega concerts to just raise awareness for the solutions that are in the room and the providers. But we have this green fund attached to it where I'll take like $5 to $25 of the ticket and send that directly to NGOs that are doing the work. Right, like you guys. So what I'm super excited about, because I know I'm a young leader, but I think it takes radical collaboration to achieve these 17 goals, right? So what I'm excited about is as I'm on this road to 1,000, finding the adults, the leaders with the platforms and the means to do this a little bit differently, to make progress on these goals. And so I hope I find more of those adults out here today that want to make an impact now, not 2045, not 2050, right? We're doing this right now. We're decarbonizing the entertainment industry. We're bringing clean energy concerts. We are funding organizations that are getting people the solutions on the ground, implementing the work. And I'm so happy to bring what you guys do to mass media, you know what I'm saying? Because a lot of kids, they know like Kanye West or Kim Kardashian, but you start talking about clean water and sanitation, they're like, what? Goal 6, what? So guys, thank you so much for allowing me to be a voice to bring you guys to the world, and I hope we can continue to do that all the way into the Project 17. One song for each goal, each song with a major artist, each song with an NGO that's doing the work and a sponsor that's helping us own the music so we can give this to the people. So thank you so much. Let's get the world plugged in.
Thank you, AY. As Bruce was talking to AY earlier, we were just commenting on your energy. And isn't it refreshing to have somebody who's energized and brings that energy to help find solutions and not just talk about it or rap about it, but actually to do something about it and make those connections. So thank you, AY, for being a young leader and motivating and inspiring each and every one of us. And so I want to encourage each and every one of you to attend tonight's show. AY will be on campus at the Carolina Union Auditorium. So please join us. It's a free ticket, and we'd love to see you out. We don't just want you to see the Friday Center, and then the Courtyard Marriott, and then back to the Friday Center, and then the Courtyard Marriott. Come out to campus and see what UNC is about. It'd be great to have you there. And I do want to give a shout out to Heidi Rickles from Freshwater, who is sponsoring AY's performances here on campus. So thank you, Heidi. And that leads into my next announcement about our Spotlight series. Gary White will be speaking at the Spotlight series this afternoon about water investment and financing. As Matt Damon mentioned in the video, Gary is an alumni from ESC, and so it would be great for you all to come out and meet Gary here in the auditorium after the plenary session and after lunch. And so without further ado, I will bring up our plenary folks, starting with Yogita Mumson from the World Bank, who will get us launched into plenary number 2.
Wow, that is intimidating. After Matt Damon and A.Y. Yan. Never thought I'd have that kind of lineup before coming up. Thank you so much for joining us for the Day 2 plenary here at this very important conference. This plenary is on the role of the state in WASH. My name is Yogita Mumson. Can you hear me okay? Yes. Okay. My name is Yogita Mumson. I am the manager of the Global Water Services of the World Bank Group. I'll tell you a little bit more about what we're doing in the World Bank Group in a bit, but we're going to kick this off with a video that's been prepared by Mr. Sitali. Most of you know him as Sitali of Sanitation and Water for All. And this video was recorded at the sector ministers meeting last week in Madrid. And it's about highlighting how to make progress and move forward during times of change. And just one note for those of you who may not be aware, Sitali first talks about a book on Who Moved My Cheese. So if you're wondering why he's talking about cheese, it's because there's a book about Who Moved My Cheese, and it's about how to adapt to change. So let's have this video, and then we'll move on to the panel.
When I first read Who Moved My Cheese by Spencer Johnson, I thought it was just a simple story. 4 characters, a maze, and cheese. But the cheese wasn't really cheese. It stood for the things we depend on, our success, our stability, and yes, in our world, it could very well stand for safe water and sanitation for everyone. Every day, 4 characters went to the same spot to enjoy their cheese. They assumed it would always be there, but one morning, the cheese was gone. 2 of the 4 characters froze, blaming, waiting, hoping things would go back to the way they were. The other 2, Sniff and Scurry, started moving. They went searching for new cheese because they understood something profound. The very maze, the maze itself, had changed. And that change was important for them to take the next step. And I can't help but think that's our story as well. The context we operate in wasn't what it was a few years ago. It isn't what it was even a few months ago. And for those working in the Sanitation and Water for All partnership, it certainly isn't what it was just a few weeks ago. Because in our sector, our cheese has moved. The maze around us is shifting. Climate change is redrawing the map of water security and the resilience of our sanitation systems. Budgets are tightening. Priorities are shifting. And communities on the other end are asking for services that are not just there, available and affordable, but resilient, reliable and just. They want the services delivered fast enough to as many people as possible and services that can stand the test of time. And now, across much of our sector, aid cuts are changing the landscape again. Projects are slowing down. Partnerships are being redefined. Governments are making difficult choices about what to protect and what to pause, sometimes having to pick winners and losers among bad options to avoid wholesale catastrophes. So, the question isn't who moved the cheese. The question is, how will we respond? And that fundamental question needs to be answered by everyone. To explore that question, we asked our partners, our government partners, a simple but vital question. How have aid cuts affected your work in water, sanitation and hygiene? 17 of them responded. What they told us was both sobering and inspiring. Some governments said programs had stalled or even stopped completely, from sanitation campaigns to rural water systems. Others had to make hard choices, making sure that they're cutting programs that provide services to women, children, and rural communities recovering from conflict. Many said they were trying to adapt, coordinating better, or even providing new funding streams. Some have found ways to keep moving. Others are still searching for their next step. And through it all, there's still some unmistakable thread which we saw at the just ended sector ministers meeting hosted by the government of Spain and co-convened with UNICEF. A bold determination, a conviction that even as old pathways close, integrated ones must open as we go forward. That's what resilience looks like. That's what leadership looks like. And that's the kind of leadership that we're looking for. In Who Moved My Cheese, the ones who found new cheese didn't wait for perfect information. They took small steps, they tested new routes, they learned and kept moving. That's the kind of leadership our sector needs. The kind that anticipates, adapts, and acts. So, as we gather here at the UNC Water and Health Conference, let's be the ones who move with courage, who move with evidence, and with purpose. Because the cheese may have moved, but our mission hasn't.
I think that really helps set the stage and follows on from the conversations that you had yesterday. I understand that there was a lot of anxiety in the room and a lot of discussion about who will be the new players. I'll put it very bluntly. Sometimes I felt there was a discussion of who will come and save us. And really, at the World Bank Group, we're seeing this as a time of opportunity. And last year, we put forward a new World Bank Group strategy on building a water-secure future. We had a very long, detailed discussion with the board, who was very positive and supportive of the water, of meeting the water challenge. And we are actually, my boss is having a very important meeting today on moving this water security challenge forward in the World Bank Group. And we're looking at a new, you may have heard of M300, which is a move towards helping electrify Africa over the next few years. And in the World Bank Group, we're looking at Mission Water, which is about reaching hundreds of millions with access to water, building a water secure future. So we're looking at water holistically. This also includes irrigation, building the water resources that support irrigation and wash. And so we believe this is a time of bringing everyone together, the MDBs, philanthropies, private sector. But at the World Bank Group, very critical to our work is the state. We, at the World Bank part especially, we work with the state. That's our client. And the state at different levels can be, because it's across World Bank Group, World Bank and IFC, can be the national level, can be at the municipal level, but the state is at the heart of service delivery. And ultimately, whichever partners we bring in, ensuring that we're working and leveraging the power of the state is going to enable us to meet the access gaps. This is our view. And we're interested to see what your view is and what the view of the panel that we're going to call, how they feel about the role of the state in WASH. So I'm going to call up, and I'm not going to give long introductions because I think you've heard from some of them already, and the bios are in the pamphlet. But I'm going to call up our 4 panelists to join me. Secretary Ashok Meena from the Department of Drinking Water and Sanitation from the Ministry of Jal Shakti, India. If you could join us, please. We also have Professor Tanvir Ahmed from the Bangladesh University of Engineering and Technology. Professor Ahmed, if you could join us. We have Dr. Mary Ariam Asinyo, from the Ministry of Health, if she could kindly join us from Ghana. And then last but not least, Gustavo Saltiel. Gustavo Saltiel is a former regulator, water regulator from Argentina. Sorry, if you don't mind moving one step down, that would be great. Just because of the mic. Thank you. Gustavo Saltiel is a former regulator in Argentina and also was the global lead for water and sanitation at the World Bank Group, so fellow colleague of mine for some time. So if you could please welcome the panelists. So, oh yes, let me not forget. You are familiar with the famous Slido, and I heard that it went very well. So the QR code is there on the side. It will remain there on the side throughout the session. So you can scan it now or later. Maybe now would be a good idea. So you will submit your question through this. It'll only be visible by you until approved by the moderators who are sitting here. There's the judges here. And then you get to vote on the different questions. The popular questions will pop up and we'll hear from them. And then there's some guidance on, let's see. Yeah, there you go. There's a guidance. Keep the questions short. And questions have a question mark at the end, so be precise and pose it as a question. And that's going to give you a higher chance of getting thumbs up and being approved here. So some housekeeping. So on the role of the state, we've heard, if you were lucky to join the session yesterday on Rural WASH with Sri Secretary Meena, he gave some very good insights into what's going on in India's rural WASH sector. So yesterday we heard a lot about the commitment that you're putting, financial commitment, champions from Prime Minister Modi, from the top leadership, able to bring in the top actors and actresses from Bollywood to help galvanize and really rally around the cause. Besides those 2 very important things, what would you say are the institutional reforms that made this progress possible?
Thank you, Yogita. I think you clearly mentioned that leadership and the personal involvement of the leadership was very important. But besides that, two things have happened. That personal leadership of the Prime Minister was important, but the leadership at various levels also need to galvanize. So the political structure that India has, where various parties compete for the democratic leadership at various levels, they were also galvanized. And water and sanitation, in a sense, was made to be a issue on which become a issue which becomes important for elections when they take place in democracy. That is how the government of India approached the entire thing at political level. So I would say there were the four pillars: leadership, institutional reform, digital governance, and the citizen participation. So if you take one by one, you already spoke about the leadership of the Prime Minister, and he taking up with all the chief ministers at the province level this issue of WASH, not only as a one-time activity, but every month he makes it sure that water, sanitation, and hygiene are spoken in his monthly address to the nation, which is Man Ki Baat, and he ensures that the political leadership participates in that dialogue. So he is keeping it alive for last 11 years. So that's a strong political commitment that we see in India. As far as institutional reforms are concerned, the whole design when he started the thing was bottom-up approach, where the community participation would be a key component. There are three levels of government in India: national government, sub-national government at provincial level, and the local self-government. In rural areas, it's called Gram Panchayats. In the urban areas, these are municipalities. So in rural areas where my department works very closely with the local self-government, the village action plans need to be drawn for WASH by the village level committees in the Gram Panchayat. These plans get aggregated at the level of district, where district water sanitation missions were set up. Then at the all the districts are joined together at the state level, which is the provincial level, where state water sanitation mission aggregates the state level plans, and the national level we provide them the funding, and the funding is not full funding. It's basically a participative funding where we take up some funding from our side, but rest of the funding has to come up from the provincial government. The local self-government also needs to contribute in shape of community contribution, their own resources, and also the funds which are devolving to them from the national and provincial level are tied up for the WASH program. That was very important, because if you have funds available at the local government, then only they can perform. So institutional approach would be the second aspect I would think was important. The third thing was use of technology and the robust monitoring mechanism which is possible when you apply technology. The application of technology was also very interesting. It was not applied only for the monitoring purposes. We evolved systems, the applications which actually make citizens participate closely with their local self-government for delivery of water service and sanitation service. And as they use the technological tools on the cloud, data is available at the national level and the state level, and we can monitor. So we actually monitor it as an observer, not for the sake of monitoring data entry is done. So I think the use of technology was very important. We have local applications which are used by the local people even in rural areas. So this was important. One more important thing to bring community participation, particularly for water, was water testing activities and water quality surveillance, which involved training of 2.5 million women across 500,000 villages, and they were trained to utilize the field testing kits which are provided in all villages on regular basis, including in the schools, and upload the data on various parameters of the water flowing into their taps. And that probably also galvanized the entire community to be aware about the water quality in the villages. The fourth aspect was the policy guidance and the enabling finance mechanism. The policy guidance was very consistent from the national government level, and the sub-national governments were asked to align with the national priority of ensuring water, safe drinking water to each household, sanitation services to each village. And for that, the O&M frameworks were created, the manuals have been created, standard operating procedures have been shared with them, and they are the ones who have to utilize the funds which are flowing to them, not only from my department, but also other departments' funds were converged at the lowest level to provide the wash services. So this was the fourth important aspect.
And was your department created specifically for these initial initiatives?
My department, actually speaking, has existed for 25 years. It was initially created as a division in another ministry, Rural Development Ministry, for making the drinking water provision in rural areas and sanitation services. But till 2014, our budget was very limited. The policy was also evolving at that point of time. The focus was not to the household. The focus was limited to the habitations and the villages. 2014 onwards, we started concentrating on households. First, open defecation has to be stopped in 2014, and 2019 we took a decision that every household has to be provided with tap water connection. So my department has existed, but its importance became very visible from 2014 onwards. So I would say WASH journey is a journey of almost a decade now in India. And the lessons which can be learned from this journey, where the work is still in progress, I would say that a lot remains to be done in terms of operation and maintenance and sustainability of these service mechanisms in the villages. But the lessons which all others can take from our experience is that we need a clear vision, a strong political will. Institutional strength has to be strengthened as much as possible at the local level, because at the end of the day, these services are local. Local people are going to consume it. So they need to be aware who is providing them services. If the subnational government or the national government provides these services, it is very difficult for the local villager to contact those levels. So therefore, institutional strengthening at local level was important. We empowered the local governments with skilled manpower. Grants which go to them were tied for these two purposes, that water service delivery and sanitation service delivery is what you can use the money for. And user fee systems are being encouraged, and user fee also needs to be fixed by the local self-government itself, rather than a fiat from the national level or the state level. Digitizing and self-certification of service levels created by local government was introduced. So we don't take the reports from the government servants now as to what work has been done. What we depend on is the self-certification by the elected leaders in the rural villages, whether the services have been made available to them by themselves or not. Last but not the least, and the most important part, is engaging women, youth and children has been a very important aspect for mainstreaming the WASH services in India. Thank you.
Thank you so much, Secretary Meena. So there was a lot there to unpack, and I hope you're asking a lot of good, interesting, and tough questions for Secretary. I mean, he can handle them. We heard him do so yesterday. There was a lot there to unpack in terms of use of technology, the national, local dynamics, the champions, and the funding, and to be seen the next steps in terms of operating and maintenance, which are still to come. So it would be good to dig into that a little bit and the role of the state therein. So now we'll move just a little east to Bangladesh. And so Professor Ahmed, could you tell us a little bit about the evolving landscape in Bangladesh for water services delivery, particularly in the rural areas, but in general, and how it's evolved and adapted to, for example, the changing financing landscape?
Thank you very much. As you know, that Bangladesh recognizes WASH as a vital area of intervention, and very notable progress has been made in this WASH sector, specifically eliminating open defecation by 2015 and providing safe water sources to 99% people. But still, we face many challenges, and one of those challenges are imposed by the SDG targets, because the requirements and the requirements, increased ambition of the SDG 6.1 and 6.2 is putting a strain on the service delivery, but also there's a huge financing gap. Now, to understand this, we have to look at what's the current mix of finances and its sources that we have in the WASH service delivery. Bangladesh has moved quite a bit away from grant-based grant dependence on WASH service delivery. It was probably in the early 70s or 80s, but afterwards, the government of Bangladesh has taken the leadership of getting the money required for WASH service delivery, both in the urban and rural sector. We have the involvement of multilateral development banks who are contributing to mostly in the urban sector for water supply, sanitation, the large infrastructures and things like that. So they are involved. For the rural WASH service delivery, it used to be, as I mentioned, it used to be aid dependent, but post 2000, the government has taken the leadership over, and it's spending probably currently the portfolio is over $1 billion in rural WASH services and infrastructure. There are some activities by the NGOs, but that's minuscule compared to what the government is spending. And there is also some small grants, but that is mostly spent on capacity building or technical assistance, etc. There is increased and somewhat unappreciated involvement from the microfinance institutions, and they have been growing in Bangladesh. As you know, that Bangladesh is a big landscape for microfinance, so microcredits, loans, and things like that. So people are taking, in the rural areas, taking small loans for installing tube wells, constructing toilets, and also tube wells, toilets which are also climate resilient and those type of infrastructure. And this is gradually growing. And we think that this is a part of this evolving financing landscape. And a lot of money is spent from out of pocket from the people. So,
and what do you see as the role of the state in that space?
So, as you know, that we still have to meet the SDG targets. We have a huge financing gap, and we see the leadership. We envisage that the state will take added responsibility for reducing this finance gap, of course. But there is also a question of regulation. There are various infrastructures which operate and are not operating in a manner that we want, especially because we cannot collect enough tariff. As the Honorable Secretary mentioned, the user has to come forward, and this is where the involvement of the local government has to increase, and to provide them with the service delivery mechanism where we can really get the money which is required for the necessary operation and maintenance. But also the large financing gap for the infrastructure. The state will have an added responsibility to meet the financing gap for the rural wash service delivery, which we think that the role of state will be important. Also, we think that there are also unregulated, for example, since people are spending money to construct tube wells, there are lots of tube wells which are unregulated. And we don't know the water quality, we don't know what conditions they are being installed, or in what scenarios, or what sort of climate hazard areas these tube wells and latrines are being installed. So we need to actually have some sort of blanket regulation, either through the MFIs or through the other wash service providers, so that these investments that are people paying from their pocket, these are also installed in a manner that the technology is appropriate and climate resilient and fit for the purpose. So there are many aspects where the state can still contribute in providing this type of regulatory environment.
Great, thank you. So over to the health sector. As this conference shows, WASH and health are adjacent sectors. Dr. Arsenio, if you could tell us a little bit, how can we learn from each other? Health has managed to work across these many layers, as Secretary Meena talked about in India's case. What kind of lessons could we take away in WASH from your sector, particularly from the Ghana lessons?
Okay, thank you very much. Hello, everyone. So this morning, I was having a very interesting conversation with one of the delegates, and we were talking about the public choice theory. And we concluded that everyone is part of government. So the lesson is that when we talk about government or the role of the state, we are usually looking at the Minister for Health or Sanitation, the directors, the president, the state apparatus. But actually, all of us are government. Everyone is government. So we elect governments and we give them our authority. So when I go to work and, for example, when you go to the World Bank and you come home, you actually come back to government because you come back to your home. And your home is governed by government. Everything in your home is government. If you go to UNICEF, WHO, if you go to non-government, non-profit, everything is government at the end of the day. So the conclusion that we came to draw is that every stakeholder needs to support government in the role of the state. And really, when you see the results we have achieved so far, although we talk about countries that have made progress, you see that really no government actually achieves those progress alone. If we didn't get the funding from WHO or UNICEF or USAID, now we are crying because USAID has withdrawn funding. Yeah, so the role of the state is not just the state or the elected government, but it's all of us. So that also means that we need to support government in the key areas. I'll start from you mentioned all levels of government, but let me start from the global level. When our leaders attend all the global meetings and they subscribe to all the conventions and the decisions that are made on the global stage, they need a lot of support to be able to translate those intentions into actual outputs and deliverables so that the people who need wash services can have access to them. Otherwise, they just remain global intent. It's our plan, this is what we intend to do, or this is what we prioritize and we subscribe to. But at the end of the day, it doesn't get translated to the deliverables, the outcomes that the general population needs to get to improve well-being. This also means that we need to work together to be able to uphold the central points that government establishes. So the role of government is in coordination. That means that government needs to set the agenda to tell other stakeholders that this is our priorities for this year. This is where we want the funding and the resources to go. But every stakeholder also has the responsibility to be able to uphold the central agenda of government. There are situations where people go into countries and they are not really working to support the agenda that the government has set. So again, from the public choice theory, we know that some governments may set agendas that do not prioritize the health of the people. So this is where stakeholders need to deliberate to be able to co-create the agenda, but not implementing parallel systems, because really for us to be able to sustain the gains of government, they must be integrated into the machinery of government. So that is also a key advice that I would give stakeholders. The other advice I would give is for us to be able to make the environment governable and fundable. When I stepped out of government occasionally to work with other non-government organizations on WASH, I had the opportunity to learn something that when I was in government, I didn't realize. That organizations don't just give government money. So if I have money and I want to select 10 countries to send money to, I would do a risk assessment. All the agencies, the international agencies do that. They don't just come to Ghana and give Ghana money. There's a reason why they will come and give Ghana money. And that is because the environment is favorable for implementation, it's favorable for governance. And stakeholders also contribute to making sure that the environment remains governable, it remains fundable, and it remains trustworthy for stakeholders to be able to contribute to make sure we implement WASH. And then the final one that I would like to add at this point is keeping an eye on the landscape. Sitali talked about Who Moved My Cheese. Coincidentally, it was also one of the first books that I read. One of my nurses brought it to me, I think just about the first month that I assumed office as the hospital director, and I read it. And I think that it's a very simple book, but it's been one of my most valuable books that I've read in my leadership journey. So apart from the funding landscape that is changing, also the epidemiology landscape is changing. So when you look at the lower middle income countries, we are now seeing a rise in NCDs. We've always seen that it's been rising, but now NCDs are far, far ahead of the communicable diseases. And so people will begin to make a case that, well, if non-communicable diseases are the ones that are a priority, where is the place for WASH? But my argument is whether you came to the hospital with hypertension, which is the highest driver of the NCDs, it doesn't take away the fact that safe care, clean care is still safe care. We are still providing care in healthcare settings, and we need to make sure that clean care remains safe care. So as long as we are providing health services, WASH is still very important. And it takes government and stakeholders to make sure that that agenda remains a key priority of government business. Because sometimes we also need to make sure people understand the concept of WASH and the issues that we're talking about. We should not assume that when we sit in the meeting rooms, everybody actually understands. Not all the time. So we need to continue to even keep an eye on the changing landscape and make sure we are sustaining the agenda, and that is government. And when I say government, it's actually all of us supporting the elected government to make sure that we are able to translate the global intentions into actual output for the general population. Thank you. Thank you. Yeah.
So some interesting points there, and you hit on policies and institutions, and we're going to turn to regulations to Gustavo Saltiel, who was a former regulator at Argentina, and also given we are all the states, is one proposal. A regulator plays a certain role. vis-a-vis actors who may or may not be considered state. So Gustavo, back in your days as regulator, what would you say worked well and did not work? And when thinking about that, what steps does a government need to take in order to establish a competent regulator?
Thank you, Jovita. Good morning. And thanks to UNC and the Water Institute for the opportunity to be part of this distinguished panel. Real pleasure to be here in Chapel Hill. So on what works and what doesn't work from a regulatory point of view. And I would like to make a first point that regulation, in general, we talk about regulation, but from our experience, my own experience as a former regulator in Argentina, but also the work done by the World Bank on the so-called PIR framework. PIR stands for Policies, Institutions, and Regulation. Clearly, we should not look at regulation in isolation of the rest of the government structure. So, what works and doesn't work? First of all, I think it's important to recognize that different governments have different motivations and drivers for sector reforms. And for instance, going to the case of Argentina, that in the 90s was considered a flagship reform or privatization of the water and sanitation services along the transformation in England and Wales. I mean, these were two of the flagship privatizations. What did the government well, what worked and what didn't work? So it worked the creation of a very strong, from a design point of view, a very strong regulator called ETOS. ETOS in Spanish stands for Tripartite Regulatory Agency. And tripartite because it was constituted by three jurisdictions: the national government, the government of the city of Buenos Aires, and the government of the province of Buenos Aires, all of which had a say in the provision of services in the metropolitan area of Buenos Aires. So this was an important decision that worked, because integrated and mitigated the political opposition for decisions that the government would take by bringing key stakeholders as the three governments into the institutional design of the regulator. So this is one thing that worked. The second, and this is a very important one, is the integration, and I will highlight this if I have the opportunity, in this forum, another forum, which is the integration of economic regulation, environmental regulation, and water quality regulation into a single agency, into a single entity. This is not the model that England and Wales followed. And I will compare both because these are contrasting experiences in many senses. Because of the lack of integration in the case of England and Wales, the system failed. As some of you may be aware that recently the so-called Independent Water Commission in the UK identified the conflicts between the environmental, economic, and water quality regulators as one of the reasons for the failures in the system. In the case of Buenos Aires, it worked. It integrated the different facets of regulation. What did not work in the case of Buenos Aires and Argentina in general, but worked in the case of England and Wales, is the political dependence of the regulator. It was very well designed on paper, de jure, very well designed, very strong. De facto, it was influenced by political decisions. So this is something that didn't work. You asked me in general about the government, right? And government has many different facets and dimensions. So you have the regulator, you have the government. The regulator, where I worked, did different things that worked very well. For instance, the creation of a customers committee, going back to participation. This also safeguarded regulatory decisions against potential opposition of the society. Why? Because civil society organizations were part, or not necessarily part of the decisions, but provided very solid technical background, taking into consideration the interests of the users, which was first to expand the service and second to pay a reasonable price. And this commission or committee that integrated different civil society organizations developed very thorough analytical work and papers that informed the tariff review processes led by the regulator. How did they do that? They worked with universities, with academic institutions that provided econometric models and surveys of the population and so on. But the whole thing gave regulatory decisions and the government much more legitimacy. What didn't work so well, I mean, alongside these wise decisions that I highlighted, including the integration of the regulator, the tripartite nature, the participation of the users or customers of the service, which worked well, you had political decisions that interfered and didn't work so well. And to conclude, the experience of Argentina is very interesting, and I think it's worth looking at it. After 20 years, the services were privatized because in the middle, they were re-estatized by the government and now back to privatization. And some people here and everywhere may be critical of this pendulum, and it's fine. But what I would say to conclude is why the next administration, with a different political approach or ideology to the previous one, changes, is because the system has weaknesses. Because of the political interference and because of the constant renegotiations of the concession contract in the beginning, the next administration had the legitimacy to cancel a concession and re-estatize. And now, because of the low performance or poor performance of the state-owned company, the new administration that is in favor of private participation has, I would put it this way, has the excuse to re-privatize. So, to conclude, having independent regulators, independent at least from a technical point of view, solid with capacity, and civil society participation in the decision-making to make it more transparent are things that I would suggest to consider in the design of regulatory frameworks and regulatory governance. Thank you.
Thank you. Thank you, Gustavo. So what I'm taking away so far is, and Gustavo's example is another demonstration of the state's role in regulation. The state is all present. We are all the state. And what is the role of the state? It will vary, but what we need to recognize, what we do recognize, is that the state is central. And what can the state do to be most effective? What can we, as all different stakeholders, do to support the state become most effective? Because, as you say, political winds will change. Political winds will blow, and things may change. And policies are guided by new administrations. And how are the institutions that we have going to withhold in those times of policy change? And then how do things like regulation help move, whether you're a state player, whether you're a public enterprise, or whether you're a private enterprise? Ultimately, everything comes back to a sustainable sector. The sector is financed by taxes, transfers, and tariffs, regardless of who the provider is. Comes back to we're all the state. So that's my brief summary of that first. And when we go into the second round, please note, I think you just have a minute to respond. Otherwise, we won't get to do your last soundbite. So just 1 minute, keeping in mind this omnipresent view of the state. Secretary Mina, would you say that the progress India has made is unique to India? And there are many things that are unique to India, as in every context, in particular India. But Is it only specific to India, or is there anything we can take away that you think others can learn from and benefit from?
I think you're right. I think India's context is very unique, but the lessons while we implemented a WASH related agenda in the country are universal. Some of them I would just like to share with all of you. Most important aspect is the policy clarity. So clear national vision backed by the long-term planning provides foundation for sustained progress. The second important aspect is the institutional accountability, and clearly defined roles, responsibilities, performance metrics, transparency and effective implementation will take us a long distance in implementation of WASH services. Therefore, India adopted a very decentralized, community-managed approach for rural services, particularly led by women and guided by the village action plans. This ensures lower life cycle costs, unlike urban areas, and has greater reliability of services for the local people in rural areas. So this is one lesson I would recommend for the Global South, where rural communities WASH services involved. Community participation and behavior change, along with the local ownership, is a key to success. Mass mobilization through Jan Andolan or people's movement was a key aspect that India experimented with. This is also, I would like to recommend that we must make a WASH agenda a continuous agenda, because every day services have to be provided. Untapped potential of women, youth and children have to be harnessed in every possible way, starting from schools, preschools, to the woman leading the service delivery has to be tapped. And last but not the least is the use of technology. Now the entire world is living in an era where mobile phones, internet is available everywhere. So technology must be used to ensure that this service delivery is assisted by technology. And since the technology is getting used at the local level, it also gives us opportunity to monitor it effectively. Operation and maintenance is the most important aspect, and the local communities need to take charge of that. Otherwise, we'll get stuck into the cycle of build, neglect, and rebuild agenda. So these are the important lessons I would recommend that we can take from the India's experience, and we are always available to share our experience with any country which is willing to experiment with these ideas.
Thank you so much. Thank you. And I know that we at the World Bank Group have been able to have some exchanges between some of our client countries with India, so that's...
Yes, I think lots of other delegations from other countries are visiting us, and we would be very happy to assist them in capacity building of their leadership, showing them how the things are working at the lower level. We would also encourage women leaders from the Global South countries to visit and see how in action the village communities led by the women are delivering these WASH services in the villages. Thank you.
Thank you. So let's move to Bangladesh. And could you tell us a little bit about how you see the role of the state in helping better integrate the different implementing partners for WASH?
Thank you for the question. I think I also mentioned before that the role of state remains to be important in coordination, regulation, and overseeing the service delivery by the implementing partners. For the case of Bangladesh, I think it's important to recognize the role of the NGOs, that they, although they operate with very small grants, it's not enough to scale up a service delivery, but what they have done is they have created very important examples and case studies, innovations in wash service delivery, which can rapidly be scaled up at the national level. And we have such instances. So all of these have to be now considered in future WASH programming. For example, I can say that so far we have not done a very good job in targeting the hardcore poor or the hard to reach areas in our WASH programming. And the NGOs have a very intrinsic understanding of this, and they've shown case studies which they can target them for the WASH service delivery very adequately. So these can be learnings from them which can be used for the national programs led by the government. The NGOs also have, so we know that in Bangladesh we are in the rural wash service delivery, we're suffering in some aspects. For example, most of the community-based infrastructure, which are led by the community, is not working. We also have, because community operation and maintenance is not delivering the results, and many of these infrastructure is being damaged or not working. So, but there are also some examples where a professional service delivery mechanism for operation and maintenance is really doing the job. And here the NGOs and the private sector can get involved because there is some scope for business generation as well here. There is, we also have the NGOs can also help in the site selection and where the appropriate selection of the appropriate technology and where it can be applied. And all the knowledge that has been garnered over the years, this can be used in consulting services, providing capacity building, providing technical services in different government projects which are currently now being scaled up. And we are now seeing such instances where we all know about the citywide inclusive sanitation projects and other wash service delivery projects where some of these experiences from NGOs are directly being used and now being scaled up.
Thank you.
And lastly, maybe I can mention that I also mentioned it earlier, that the microcredit institutions, which are providing small loans for small infrastructures, these has to be regulated as well. And we need appropriate knowledge of what type of infrastructure is suitable for what location. And this is something that where the role of state or the government can do more in providing technical services and suggestions.
Great, thank you. Thank you. Now we'll move to the health sector. Dr. Arsenio, so you've heard about, for example, NGOs and the grants that they've received being more at risk and moving to microfinance. We've heard a bit about private sector. Listening to this discussion, do you have any suggestions for the WASH sector on reducing aid dependence? And if you don't mind, just a minute because we're out of time.
Okay, thank you. So just last week, African leaders gathered in Durban for the Conference of Public Health in Africa. I think that's the second largest conference in the world after the World Health Assembly. So this is a very important policy forum. And they endorsed what we called the Durban Promise. So I just want to share a few highlights of what countries or state governments think they should be doing for public health, of which WASH is very central. So the first one is domestic resource mobilization. We, in Ghana, for example, at a point just before COVID, most of our WASH funding was coming from the development partners. We are now, we shifted gradually. It's not as if government is still providing a lot of the funding. We have a costed national strategy, but there's no plan as to how that money is going to be mobilized for actual implementation. So domestic resource mobilization is very, very important. The second one is domestic resource efficiency. So funding is not just asking for donors to bring more money, but the money that is already available, how efficiently it's being used. So this also means more efficient governance and accountability mechanisms. The third one is integration. So WASH, for us to sustain WASH services, has to be integrated. We are talking about climate change. We're talking about the pandemic readiness, One Health, and planetary health more recently. So all has to be integrated. WASH has to be integrated in all of them. The fourth one is reframing WASH as a strategic investment for health. So for health and also for the economy of countries. I think finance ministers speak language when you begin to say, if you invest $1, you're going to get $20. So we need to strategically position WASH as a strategic, as an investment for not just health, but also well-being generally. Then we also need to go back to primary health care. So usually when people say WASH sector and health sector, I always tell them that sanitation is one of the pillars of primary health care. It's always been there so far as we started talking about health. So we need to continue to position primary health care as the concept, the foundation that underlines all future conversations and concepts that emerge. And then community participation has been talked about already. But also just to say that when it comes to health financing, we shouldn't always be counting in figures, but also the quality of life. So it's not just we are getting $20, but how much disability adjusted life years have we been able to achieve, and how much quality adjusted life years have we been able to add to the population. That is also a benefit of WASH in health. Thank you.
Thank you. Thank you. And that's an important point about utilization of budget, the efficiency as well. There was a study, a World Bank study on this, where it's in the double digits of non-utilization of already earmarked funds. So, Gustavo, going back into some of the details on regulation, because that's an important part of the role of the state in managing the different actors, state and non-state actors. What ways could regulators collaborate regionally to strengthen performance? And when answering that, what can institutes, organizations like the World Bank Group and other MDBs do to support that?
Thank you, Yogita. I think these regional organizations of regulators whereby they can collaborate and learn from each other are fundamental. In the World Bank, we have the experience of working or having supported two of these organizations. The first one was the ADERASA, the Association of Regulators of the Americas. The second one is ESAWAS, the Association of Regulators of Eastern and Southern Africa. With ADERASA in the Americas, the World Bank provided important resources for the establishment of this regional organization. It had many important outcomes, results, and achievements. First of all, with funding from the World Bank, it established 4 working groups, each one of them led by a different country. So one group on tariffs, another group on subsidies, another group on benchmarking, and another one on customer or users engagement. But by doing it that way and having annual conferences, they shared experiences. And the most advanced regulators in the group, at the time from Argentina and Chile, supported other regulators. It was fundamental in building capacity of other regulators. And this is much more powerful than trainings and courses on this and that. The collaboration among regulators that is also important because it gives the regulator or a new regulator in a certain country the legitimacy to push the service providers, be it private or public, and the government, because it has the backing of 10 or 15 more regulators. With the SAWAS in Eastern and Southern Africa, it was similar. So in terms of the support from multilateral development banks and other development partners, I would say that funding can be important. Supporting these networks and knowledge events is also important. And in the case of the World Bank, as you know well, Yogita, the World Bank has an instrument, a lending instrument called MPA, multi-programmatic approach, whereby there is a long-term engagement with a country or a region. And in the case of Eastern and Southern Africa, in this new MPA, there will be a knowledge anchor, which will be, or part of that knowledge anchor will be actually ESAWAS, the Association of Regulators of Eastern and Southern Africa, that will curate and disseminate the knowledge generated by these operations.
Thank you. Thank you. And I'm going to ask the judges here of the questions. I'm not sure we have time to go for their last round of soundbite, and I think if we have questions, we should probably go to the questions instead.
We have lots of great questions.
Well, let's go to questions instead, because our panelists had some time to be able to speak. So.
Okay. I'm not sure we want to be called judges. We're moderators.
I'm using a slow
So
hand.
Darren and I have been trying to go through the questions and then aggregate them. And I think we've got 3 main aggregated questions. So I'll give you the first one. It's a multi-part question.
Okay, listen everyone, because I'm not going to repeat them.
Yes, okay. So it's a multi-part question that is about regulation and particularly the role of the private sector. So the various questions have asked things like, what is the role of the state in ensuring that private water utilities make necessary ongoing investments to ensure fit-for-purpose infrastructure? How can the state balance its role as an asset owner and as a regulator? And how to overcome resistance among some developing country governments to having independent water regulators? How could we overcome that? And then, as
that's the first question.
That's half of the first question. But if you want to go with that,
I'm just making sure Gustavo notes that one. I think that's one.
I think a lot of that is for Gustavo,
Okay,
maybe
and the
for the
next
others.
question?
There was a question about state strategies being used to harness the private sector to address needs for affordable wash services and sway willingness to pay for services. And then there's a very provocative question about the challenges of capitalism and the myth of unlimited growth and what challenges they present to this sector and what the state could do to address them.
Okay, so let's, okay. I'm going to start with the second question, that if you could repeat that again, so for Secretary Mina to take that one.
Yes. Strategies, what strategies are being used to harness the private sector to address the need for affordable wash services and sway willingness to pay?
When I made the presentation, I did say that the local communities have to own the assets and get them operated. So when you get your assets for water service delivery or sanitation operated, there has to be some operator. And these operators typically will be the private sector. Now, what kind of private sectors will go to the rural areas to provide these services is the question. So what we are trying in India is that we have something called cooperative societies, the self-help groups of the women, or the youth organizations. They can be hired by the local self-government to maintain and operate these services. And that is how we look at the participation of the private sector in provisioning of these services. Clearly, the capital expenditure is underwritten by the national and the provincial government, but operation and maintenance has to be done by the local self-government. Now, even there, the O&M costs which are there cannot be borne by the rural communities because the ability to pay is limited. So as per our own estimate in India, almost 1/3 of the O&M cost probably will be available as user charges, which is being encouraged, that local governments levy on the users. But rest of the two-third cost has to be made by the transfers from the subnational government, national government, and also resources from other departments like health grant, etc., which are flowing to the local government. They have to use it for wash service delivery. Okay. But at the end of the day, private sector will become the operator of these services in the local areas, in the villages, to make the provision available at cost, and the cost will be borne partly by the users, partly by the national government, partly by the subnational government.
And I guess the hope is that the prices, there'll be efficient services.
So essentially speaking, what will happen is, what is likely to happen is that you will have micro utilities with different structures, either owned by the women-led self-help groups, or the cooperative societies, or the youth organizations, or even a pure private sector. They will get engaged with the local self-government, get their money for provision of these services from user charges and the transfers happening to the local government.
Very briefly, just.
Yeah, I'll just add to that. So the role of state in this case will be to provide the enabling environment for the private sector to work. Create whatever strategies or guidelines that's possible for the operation of the private sector smoothly, and providing them with capacity building for this type of service delivery, and to make these self-help groups to a professional organization, something like that.
Yes, perfect. Dr. Asenso, do you want to add to that? Just briefly, please.
I think what I wanted to say is that governments have to develop a framework for private-public partnerships. In some countries, there's no framework, so it's not clear what the contribution of government should be and what's the contribution of private non-state actors should be, and when the incentives or the benefits also emerge, how that should be distributed. So in the hospital where I'm a board member, this is like the largest hospital in West Africa, Ghana's largest tertiary hospital. We try to embrace PPP in the past, and almost everything is taken up by private people, but there's no framework. They just come and sit with the CEO or the board and say, we will take 60% and give you 40%. But what is the science that goes into distribution? What determines that you take 40% and government takes 60%? Because government has a huge contribution in infrastructure, in water, in electricity. So if government does not have a framework where stakeholders can use to establish PPPs, then it also means that we are not going to have a very equitable partnership. So governments have a responsibility to make sure that there are frameworks for PPP. Okay.
So
do you want me to answer one of the other questions? No?
I think I'm going to thank you for that. And so, Gustavo, you heard Professor Ahmed and Dr. Asenso talking about the enabling environment and the framework. So if you could answer that question, the triple-barreled question as best as you can.
Which one of the questions? Because there was, Clarissa, you
Why
read
don't you just pick one, Clarissa, because there's too many in there.
A good question perhaps for you to tackle would be the role of the state in ensuring private water utility companies make necessary ongoing investments to ensure fit-for-purpose infrastructure.
Okay, thank you. So the role of the state, and I think we have learned a lot over the last 30 years, in particular in regards to private participation, is basically to give up some power and transfer it to a solid regulator. There is no other way. I mean, of course, there are different institutional models, depends on whether the country is federal, is unitary, states, local governments, etc. But a regulator is the organization and the institution, in the broader sense of the word institution, that will warrant balance between the different interests in the society. The interest of the investor, the private operator, but also the interest of the users. I think it's fundamental. If you give me 30 seconds, Yogita, I will also answer that point. I don't know if I got it right, Clarissa, but somebody mentioned capitalism and a provocative question. Look, on this issue, I would argue that, private and capitalism and socialism or whatever related to water services is a false dichotomy. As an example, Cuba, some of you will be surprised, Cuba has private operators, a communist country. And the US, here, most of the service providers are public. So, in a capitalist system, most of the providers are public. And in a communist place, even China. China has a bunch of private operators. So this is a totally false dichotomy that doesn't help. Does not help the sector to continue fighting whether private or public. We need both. And to have both participating and providing solutions, you need strong regulators. Sorry, I'm biased. I'm a former regulator. I cannot avoid it. Thank you.
Did you want to add something?
I think just related to that, when we are talking about the private sector providing the services, as Tanveer was mentioning, capacity building and building that private sector ecosystem itself is a huge ask in the rural areas. So therefore, we have something called Nal Jal Mitra program, in which we select 2 or 3 people from the village and provide them the extensive training for becoming the water service operator. Once these operators are available, then they organize themselves into a kind of enterprise to provide these services for which they are paid for by the local government. So at the end of the day, private sector will be there for making the service provision, which is funded by the governments and the local self-government. And these private sector people would act as micro-utilities at the village level and macro-utilities in case the bulk water is being transferred from long distances. Even the macro-utilities would be provision with the help of the private sector. So private sector participation is a key, but what kind of private sector we are talking about is most important, and that their capacity building to make everybody participate in this ecosystem is important.
Thank you, and I'm going to let the Secretary have the last word on that, because I think he summed it up very well. And in talking about the private sector, it's also about the role of the state, which is what this discussion has been about. And what's clear is we need the private sector, we need NGOs, we need many different actors to help service delivery, and ultimately, in order to get the most out of them, to get the most out of communities, to get the most out of all of us, we need to have a healthy, strong state. And that will involve from the level of the regulators to the Prime Minister. And so the role of the state is strong, as they say in the State of the Union address. So thank you so much.
Hi, everybody. That was fantastic, by the way. Thank you. Thanks to Kada, to Joe Brown, Ryan Cronk, and the others from the Water Institute for just giving me a couple of minutes in front of everybody here to talk to you about something very exciting. So I'm Guillaume Wright. I'm the executive editor of PLOS Water, published by PLOS. We're a not-for-profit open access publisher. And I'm really proud to say that we're currently in the 3rd year of our partnership with the UNC Water and Health Conference on a special collection that runs across 2 of our journals, PLOS Water and PLOS Sustainability and Transformation. And effectively, it's a single venue where we're compiling all the research and the insights that are being discussed as part of this conference and talked about here this week. It's a really inclusive collection, so it's open to both those who are presenting here this week, but also those who aren't necessarily presenting here. They're also able to submit an article. It's led by a mixture of people: Jenna Davis from Stanford, Sarah Young from Northwestern, Ryan Cronk and Clarissa Brocklehurst from the Water Institute, as well as support from Kada and the wider editorial boards of both journals as well. So as you can see, the submission deadline is the 31st of May next year. There's a QR code here which will take you to the, I know there's another QR code, but this is a good one. It'll take you straight to the submission guidelines for authors here if you're interested in publishing as part of that. We're encouraging the submission of both research articles, but also pitches for narrative style pieces, opinions and essays, which are really cool. And as I say, the QR code there, if you're interested, there's also more information on page 50 of your programme as well. And just by way of an update, given that it's the third year of our partnership with UNC, to date we've had a fantastic reception to this over the first 2 years that we've run it, and all the submissions that we've had over that time have enabled us to publish 25 articles to date, and that includes 11 of these narrative style opinions and essays as well. They've all been collected together on a specific web page with a different QR code here that will take you to that. So if you want to scan this and access all the papers that have been published to date, I'd encourage you to do so. We'll regularly update that web page with the new published articles as part of the collection, and we're also looking to publicise that web page on a regular basis. So if you're looking for a reason to come to the collection, the additional exposure and visibility of your work will come through the promotion of that web page and that collection on a regular basis. And my thanks to many of you here in the audience as well who have published, who have reviewed, who have edited papers that have been part of this collection. My sincere thanks to you for that as well. And some exciting news about PLOS Water, specifically the journal. So our co-founding editor-in-chief, Jenna Davis from Stanford, is actually stepping down from her role on the journal at the end of this month. We owe a huge debt of thanks to Jenna for everything that she's done, but in particular for connecting us to this wonderful community here at UNC. And although it's bittersweet to have Jenna stepping down, we're really, really excited to have Sarah Young from Northwestern University who's stepping into that role as our new co-editor-in-chief. Sarah, I hope you're still out there in the audience right now. So do tap her up. There she is. Do tap Sarah up this week as well if you want to know a little bit more about PLOS Water as well as myself too. And I know that many of you working in water and health will have come across and know of Sarah as well. So I hope you'll join me in welcoming her to the journal. If you're interested in the collection, what do you do? Well, I'm here all this week until Friday lunchtime. So just come and find me at breakfasts, during the breaks, at the post-lunch period. Generally, I'll be at the PLOS table, which is right by the Jessamine room, next to the registration desk, or any time during the sessions or posters. Otherwise, speak to Ryan Cronk, Clarissa Brocklehurst, Cada, and others as well. They'll be able to point you in the right direction. We have a sign-up sheet by the PLOS table. I can get your name and email as well, and I'll contact you after the conference to give you a bit more information. Otherwise, for those online, we've got mine and Ryan's contact details here. And back to the first QR code that you were exposed to again, that again has all the information that you might need as well to be contributing. And I'll just be very brief and say it's a massive honour and pleasure to be working, to be continuing our collaboration with UNC Water and Health and to be engaging with you guys in this fantastic community as well. So thank you.
Thank you, Guy. And I just wanted to remind folks and announce today that we are reserving some tables in the Trillium Dining Room for UNC ESC alumni. So please join us. Gustavo will be there, for example, Mark Sobsey, Gary White, Don Loria. So please join us in the Trillium Dining Room if you are UNC ESC alumni. We'd love to catch up with you. Just a couple of reminders that today we start our lunch series. So there will be 3 special sessions. One is the Technology and Innovation Showcase in the Sunflower Room. In the Magnolia Room, you can brush off, improve your CV and get it out there. Get some pointers from Josh's water jobs. And so they'll be walking through CVs and dissecting them and then rebuilding them. And then if you join us in Redbud, we have the Beyond the Postmortem, from Toilet Talk to Tactical Influence, which is convened by former USAID folks. And so those are 3 great sessions that we encourage you to get into the lunch line and take your lunch to those rooms. And so I will continue to make this quick, but again, Sunflower Room, Dogwood, that's not right. And this is a correction to a title. So at 1:30, the side event is moving into Innovating Oversight. So make sure if this is the one that you're interested in, please make sure you take note of that. Again, who's got their programs on them? Did you write your name on the back? I've collected dozens and dozens of programs from across the building. And so if you wouldn't mind putting your name on the back of your program, and then if you lose it, go back to the registration desk, and it might be there or it might not be. If you lose it permanently, there's a QR code. We love our QR codes here. Again, there's meeting spaces for you all throughout the building, so just sign up right on the table and go and meet with folks and join us on LinkedIn. Again, a QR code for your enjoyment. This is meant to just remind you, so if everybody can hold up their name tag. Does everybody in this room have their name tag? Yeah, looks like it. Awesome. Please wear these at all times while you're on site for security purposes, but also so that we know that you're not lost in the wrong conference. Thank you to our sponsors. I'll say this every single day, but again, we couldn't do this conference without our sponsors, and we don't pass on all the inflated costs that happened across the entire gamut of conference services and food costs. Those weren't passed on to you and your registration costs. And so that's because of our sponsors and their generous contributions. So thank you to all of them. I'm going to now send you to lunch and send you into the lineup so that you can get your lunch plates and go to the next lunch sessions. Happy Tuesday, everybody.
I've got a lot to learn.